Welcome back to Great Day Washington. This segment is sponsored by Living Beyond Breast Cancer. 1 in 3 U.S. women diagnosed with metastatic breast cancer live at least 5 years after diagnosis. That's according to the National Cancer Institute. And a tool that is helping women and others live longer is biomarker testing. Recently, our Elaine Espinola learned how that testing can improve treatment options. And she spoke to Jean Sachs and Megan O'Neill from Living Beyond Breast Cancer. Check it out.
Jean and Megan, great to see you. Thank you so much for sharing this really important information with us. First off, can you just tell us what is biomarker testing?
Sure, thanks for asking. So biomarker testing, and this campaign in particularly, is focused on those that are diagnosed with metastatic breast cancer, so not those that are early stage. But biomarker testing is a way to learn more about the tumor, the actual cancer, and what's driving it. So it's a simple test. It can be a liquid biopsy, which is a blood test, or it can be a tissue sample, so from the actual tumor. And it can reveal what's driving the cancer, what new mutations are happening, have subtypes changed, and that may lead to a less toxic, more effective treatment.
I see. And why is it so important and critical for patients with metastatic breast cancer to talk to their doctors about it?
It's so important because if you don't do this test, you won't have this information to know whether you're eligible for one of these new treatments that specifically target a mutation or a protein change. So it is so important to have it when you're first diagnosed, if your doctor thinks it makes sense, and then also if and when you progress, when your cancer changes and you have to make a treatment change, to do this test again.
Got it. And you are raising awareness with the No One Missed campaign. Can you tell us more about that?
Sure. Megan, do you want to do that?
Yeah, absolutely. So this campaign is really about making sure that people are aware that these types of tests exist. A lot of people with metastatic breast cancer aren't aware that that's something that they can ask for. Sometimes our doctors are very busy. They may have forgotten to do that. So it's really important that we are the ones that are bringing it up, making sure that we're asking questions to make sure that it's getting done. We just really want to make sure that no one is missed, that you learn about biomarker testing, you talk to your doctor about it, you get the tests, and then you can see how that might change the course of your treatment. But it's extremely important because, and with metastatic breast cancer, most of us are going to be on treatment for life. We need to know exactly what our subtypes are. We need to know exactly what mutations that we have, because with this precision medicine, we do know now that certain medications work better for some and for others. And it's because of the testing that we're having done that's really allowing us to live longer with this disease.
Sure. And Megan, are there some specific questions that people should be asking their doctors?
Yes, absolutely. So specifically, like, have biomarkers been performed on my cancer? That's a great question to start with your doctor. And then you can ask for those tests to be done. There is a little bit of an education component, which is why we hope that you visit noonemissed.org so that we can give you some of that information, so that you know what kind of questions to ask or what specific tests to ask for. But it's really starting that conversation with your oncologist. And as I say to everybody, if you feel like you're not being listened to or you feel like those tests are not being ordered for you, we really recommend a second opinion just to make sure that you're heard and that you're getting the tests that you want.
So Jean and Megan, thank you so very much.
Thank you.
And for more information on improving access to biomarker testing, you can head to noonemissed.org.